G'day guys, Dr. James Simcock here from VetDojo. I have another interesting case for you today. Just want to run through a little short story about this one. It's an 18-month-old Jack Russell who presented for a left pelvic limb lameness. It's been present for a couple of months and getting worse with time. And presented with these x-rays here, and the referring vets referred this case and were concerned about mild hip dysplasia. And what I'm interested in is looking at the muscle mass on this left and right side, and we can see there's a little less muscle on this left side, showing that that limb function has not been optimal. And interestingly, when we looked at this dog with physical examination, he was really, really sore in this back left leg. He was holding it up a lot of the time, and he was very, very painful when we actually did any range of motion through his hip. So straight away I was concerned that there was something more sinister going on than just hip dysplasia, especially with the x-rays looking like this. And even with the beauty of hindsight, looking at this x-ray, that left hip really doesn't look too bad. So we actually went ahead and did a CT scan on this dog to try and identify a little bit more about what's going on. And on this CT scan, we can see here, interestingly, that we've got this very abnormal looking femoral head. We've got this kind of eaten away section of the femoral head here. And this is another case that we've seen of avascular necrosis of the femoral head. So as I roll in and out, you can see just kind of how abnormal that femoral head looks. It should have this really nice smooth kind of appearance like we've got down here, but you can see when we scroll backwards and forwards that there's a lot of challenge in that joint. If we compare that to the normal side, which is over here, you can see how smooth that femoral head actually looks. So I'll just straighten this up a little bit so you can see it a bit better. But you can see how smooth all of that femoral head looks compared to that contralateral limb. So another interesting case that I just wanted to highlight a couple of aspects of, just the fact that this dog presented with a very severe lameness, very painful with manipulation of the hip, which is not typical for a dog with hip dysplasia, had that muscle atrophy. And what's interesting is this dog had fairly normal x-rays. So if you see a case like that, avascular necrosis of the femoral head should be on the radar. Saying these owners, I haven't seen a case in a number of years, and I've seen probably 4 or 5 cases now in the last few months. So definitely something that we see out there. The way that we managed this dog was actually with a femoral head neck excision, and those x-rays, post-op x-rays, I'll pull up for you now so we can have a look at those. So this was cut by one of the other surgeons here because I was in another procedure. So this is the post-operative femoral head neck excision x-ray. So we can see that we've got a nice osteotomy here going from the greater trochanter all the way down to the lesser trochanter there. So very happy with how that looks. And I think that dog should do quite well. So thanks for tuning in, and see you all soon.